Stop turning away your clients. What happens when you have a client come into your office with a condition or ailment that you don't know how to resolve? Do you turn them away or send the client to another solution? Or do you try to work on it with little or no results? Which of these outcomes is worse for your business? Now, don't get me wrong. There are conditions that take time to resolve and might require other alternatives. What I'm talking about is consistently failing to offer real healing solutions and leaving your client to find yet another option. They are probably not going to voice their opinion. Their real feedback is to stop coming to you. This doesn't have to happen. You should be able to handle up to 98% of the conditions presented to you without having to turn anyone away. And that's going to all be accomplished under one modality and one main tool, a weighted tuning fork. That's right, one solution. It really can be that simple. Here's why. The cause of most conditions, whether it's pain, mobility restrictions, digestion, organ malfunction, chronic disease, or injury recovery, the underlying physiological process is the same. I'm talking about inflammation. It's your body's natural response to any injury to cells or tissue. And the process of inflammation is responsible for swelling, organ dysfunction, pain, and ultimately cancer and other forms of cell death. Inflammation means swelling. Swelling means fluid, and fluid means pain. If you search for the definition of inflammation, you'll find all of the components that I'm describing. It's the first thing we think of when something is wrong, but you never blame the inflammation. You just accept the pain as a symptom, never really consider the real source of pain. Generally, it's the inflammatory fluid that's causing most of the problem. In fact, the initial injury might be long gone, but the inflammation and the fluid are still there. This is because the injury never really healed. Something was left behind, and the final cleanup stage never completed. We naturally think that if something no longer hurts, then the injury was gone. You are healed. That isn't until years later when that sports injury from high school comes back to haunt you one morning when you're greeted with chronic pain. The scar is still there, and some unrelated movement or injury had just started a cascade of events that reactivated the failed healing process that was lying dormant underneath your skin. Out of sight, out of mind, until now. Through our own clinical experiences, we determined that inflammation is the main factor in almost every ailment, including pain relief, mobility restrictions, and all major specialty areas of the body. Sensory loss, digestion, behavioral, urinary, reproduction, whether it's chronic or an acute injury. Again, the physiological response to the body is the same. Something triggers the inflammatory process to release more fluid into the surrounding tissue. Cells called fibroblasts are changed into myofibroblasts to fix the problem. Inflammatory fluids within the interstitial spaces are quarantined by these myofibroblasts to protect the surrounding tissue from toxins. And they contain a repair process within that bubble. This is why injection sites and bug bites, they stay in place because the immune system will quarantine the problem until a solution is found. But what if that solution never arrives? What if the problem remains and it becomes chronic and cascades into other conditions that are seemingly unrelated to that original injury? We rarely know there's something wrong underneath the skin until something interrupts the normal program with a pain alarm. Pain is often associated with inflammation for a very good reason. The pressurization of the encapsulated inflammatory fluids are now pressing against the nerve endings, which creates the sensation of pain. We spend most of our time trying to mask or ignore pain until that doesn't work anymore. This might include no longer moving a body part, taking medications to mask the pain, using topical solutions to cause pain in other areas, or applying ice or compression garments to numb the pain sensors. We have been conditioned to stretch before physical exercise, which really means stretching the fascial membranes in the tissue layers to provide more space and less pressurization in already overfilled muscles and tendons in the surrounding tissue. Some healing methods are only focused on stretching the fascia rather than addressing the fluid pressure. Stretching the fascia is only a temporary solution because stretched fascia will eventually return to the normal condition by design. That's why we are sore and stiff in the morning after sleeping for hours. Sitting down and not moving, regardless if it's for recovery or pain avoidance, is the worst thing we can do for an injury or surgery recovery. Our drainage system relies on muscle movement to remove excess fluid from our tissue. Both the lymphatic and the venous system rely heavily on movement for proper function. And movement avoidance plays an active role in creating chronic conditions, as the inflammatory process develops into an endless loop and becomes the next injury to trigger a continuous inflammatory process, despite the original injury. We now know the extent of the inflammatory problems within our body and how much it affects all aspects of pathophysiology. New studies over the past 20 years have been able to see the true nature of edema beyond the visible and into the microenvironment within the tissues, the layers, the organs, the vessels, and the cellular space. We can see these spaces and we can recognize the impact within the living tissue. We call this in vivo, rather than studying dried out tissue prepared for pathological study. The study of fluid and pathology has changed over the past few years, but the treatment for fluid pressure and inflammatory conditions have not advanced at the same pace. Diagnostic equipment still has a difficult time seeing the microenvironment of fluid. Although possible to see with some equipment, the interpretation and response are still lacking. Simply placing hands on the patient or a client to determine the quality of fluid pressure pockets associated with an ailment is a lost art. Palpation is one of the keys to the secrets of fluid pressure related pain and associated ailments. The ability to rapidly release the fluid pressure and return the tissue to normal function is the way to change the inflammatory process for good. We talk about the stages of the inflammatory process, but rarely does our body enter that final stage to clean up the mess and return the tissue and the cells to normal. A sustained inflammatory process, or a wound that never heals, becomes the foundation for cancer conditions. We have so many things we can do prior to that cancer stage to release the sustained inflammatory response known as chronic conditions. We've known for a very long time that ultrasonic vibration can change the porosity of the fascial membranes to allow more fluid to pass through the membrane. We've already had treatments and entire divisions of pharmaceutical delivery based on this concept of using vibration as a response. Yet we use a device and technology that is too powerful for the cells, which causes damage and cell death. All we had to do was lower the vibration power to a sustainable and non-hazardous level and place the vibrating device in the correct spot to drain the fluid pressure. Wait, there is a device that does that very thing. I showed you it earlier. It's the tuning fork, designed to be placed directly on the skin. Of course, this device is not automatic and it's not battery powered. It does require some amount of skill and a practitioner with palpation skills to determine the correct placement. This means putting hands on people, feeling for where the inflammation is. This process has been used for ages. We've found tuning fork devices on paintings in ancient history. Both science and history have been there to show us the solution. We just needed the opportunity and the confidence to use this skill once again and return to a hands-on approach to healing with vibration-based response to inflammatory problems within the body. We have the solution. Are you ready to put it to work to heal the world? If you like what you just heard, please click the subscribe button and like this channel so that you can continue on this journey with us. Also, you can visit our website using the links in the description to learn more about our view of the body and rapid pain relief and using vibration to relieve inflammation-based conditions. Thanks for watching.